Hello, everyone, and welcome to today's presentation, Stress Less, hosted by Geisinger. My name is Michael. I'm a wellness associate, and I'm excited to begin this presentation with you today. As always, we'd like to start with our disclaimer that this information is being provided in order to increase your awareness. It is not intended to be medical advice. If you believe that you may have any medical conditions or have specific questions regarding your health, please see your physician. And so a good place to start today is just asking, what is stress? This is, of course, something that might look different for everyone, but I'm sure right off the bat, we can all relate to the different sticky notes on the person's face on the PowerPoint slide, which includes things like bills, work, teamwork, gym, dieting, their mother even. And so, of course, a lot of different things can be a source of stress throughout daily life. But overall, stress is defined as a reaction to a change in the environment. And so this is the brain's response to any demand that might be placed on it. And like I said, a component of daily life. Another way to think of stress is as an imbalance between one's perceived demands and one's perceived ability to cope with those demands. And it can also be broken down into physical, mental, or emotional strain or tension. And we can start by asking ourselves some stress statistics to get a sense of how common this really is. And so the first question here is the percentage of people who regularly experience physical symptoms of stress. So take a second now to take your pick of an answer. The options are 77%, 62%, or 89%. So how common do you think stress is? And I'll give you a second before we reveal the answer. So if you guess the first option, 77%, which again is the percentage of people who regularly experience physical symptoms of stress, you'd be correct. And how about question number two here? What percentage of people cite money or work as the leading cause of stress? Do you think it's 96%, 76%, or 54%? And again, I'll give you a second to think of your answer. Yep. So that percentage is 76%. And again, that's the percentage of people who cite money or work as the leading cause of stress. All right. And this last question here, what do we think the annual costs to employers in stress-related healthcare costs are or missed work? And so we know the answer is 300. And so what we're looking for is the unit. So is it $300,000, $300 million, or $300 billion? And again, it's for the annual costs to employers in stress-related healthcare costs or missed work. And I will say this one is probably the trickiest question, so I'll give you an extra minute here to think about the answer. So this one comes in at a staggering $300 billion. And this includes things like absenteeism, diminished productivity, and accidents, all of which can sometimes be related to stress. So it is quite a big deal and something that is worth pursuing, taking action on if stress is something that bothers you. Okay, so stress and health. What do we know? So we know that stress contributes significantly to diabetes. And it's really important to gauge how we deal with stress. It should be clear by now that most people will experience stress at some point. And so what matters is more so about how we deal with it because we know that it's going to happen. And we'll talk more about that in just a second. We also know that stress is linked to things like high blood pressure, high cholesterol, a greater risk of heart disease, and it might even contribute to cancer risk as well. So, again, a lot is at stake here between the relationship between stress and health. So, again, it's really worth reducing our stress levels. I'd like to take a minute here just to ask you and give you time to answer, what is your biggest stressor? Or what are your biggest stressors right now? So if you have the ability to take notes or just jot down some stressors in your mind, just some way to keep track and answer this question, what are your biggest stressors? Ideally, you'd be able to reference this list in just a moment. So if you need to take a second to grab pen and paper or take notes somehow, please feel free to do so. And again, just begin answering the question, what are your biggest stressors? This is a very important first step to handling stress, right? Figuring out what it is exactly that bothers us. This will look very different for different people. Something that stresses me might not stress you at all. And it's also helpful to think about what factors change your perception of stress. Your outlook, your attitude, your likes and preferences, these are all things that might determine your sources of stress. Some examples are events and circumstances like finances or major life changes. Perhaps you recently had a child. Perhaps you recently got married. Maybe you've moved recently. People and places. So things like relationships, family, work, or school commitments. And of course, even feelings and attitudes can be sources of stress in themselves, such as chronic worry or pessimism. So again, it really takes on many forms, but it's important to find your source of stress. So hopefully by now you've had a second to think about your sources of stress. And again, it would be helpful for you to reference that list in just a second. And we'll take a moment to examine the different types of stress. Believe it or not, there is a type of stress that is good stress, and it's called eustress. And oddly enough, it is considered to be a good source of stress because it is actually related to how well a task might be performed. Eustress can be thought of as motivating and enhancing. We can probably all relate to this with regards to deadlines. So, for example, thinking back to my college days, when a paper was due in about 2 months, I had very little stress about it, right? I was not worried about that paper whatsoever. And I probably wouldn't write that paper when it's 2 months out. But if I were to start writing it, I don't think the writing would be as good as it might be if that deadline were in, say, about a week rather than 2 months. I think there's a sweet spot with regards to the relationship between stress and performance. If we have the right amount of stress, that can sometimes boost our performance of a task. And the same might go for other tasks such as athletics, job performance, maybe perhaps even giving presentations, things like that. So the eustress again is kind of that sweet spot of stress. And we have a list here of different sources of stress that we're going to ask you to sort, whether it's eustress, the good stress, or distress, the bad stress. Distress is probably what most of us are more familiar with. Distress is associated with shutting down. It's very demotivating and it can probably result in reduced performance. So, in other words, it's stress that is sometimes out of our ability to manage without additional help. Okay, and so our first source of stress here that we're going to ask you to sort is having children. So I'll name the source of stress and you will sort it. in terms of eustress or distress. So again, the first one is having children. So if you said eustress, that would be correct. Something like going through divorce, that would be distress. Financial trouble, distress. Having grandchildren. Similarly to having children, that would be a source of eustress. What about something like an injury? Do you think that would be good or bad stress? Yep, so if you guessed distress or bad stress, you'd be right there. I was talking about how sometimes eustress can improve performance, but as you can imagine, something like an injury probably wouldn't improve your performance on many things. Marriage. Yep, so that would be a source of good stress or eustress. So even though marriage might be a very positive thing, it of course comes with a lot of responsibility, such as planning. And what about making new friends? Do we think that's good or bad stress? Yep. So I'm sure many of you guessed correctly that would be eustress. Experiencing an illness. What do we think that would be? Yep, distress. And then just a few more here. The next one is getting a promotion at work. That would be good stress. It might come with more responsibility, but overall, that is certainly a positive thing. And then just the last two here, the first being job loss. Exactly. Distress. And then having pets. Do we think that's good stress or bad stress? And if you guessed eustress, you'd be correct. What I'd like for you to do now is take a moment to reference your personal list of stressors that you created just a few slides ago. And I'd like for you to sort those types of stress according to whether they're eustress or distress. Hopefully, that will give you a better sense of the type of stress you might be experiencing. And maybe you've even realized that some of these sources of stress could actually be a good thing. So, after you've had a second to sort your sources of stress, there are different ways we can think about stress, and that is according to how long the effects of that stress last. So, the two types we're referencing here are acute and chronic stress. Again, feel free to reference your personal list of stressors that you brainstormed and label them as acute or chronic. The general difference, as you can probably anticipate, is that acute stress is a brief fight or flight response, which is often characterized by an increase in heart rate, an increase in breathing, even some more subtle changes to the body, such as increase in blood pressure or glucose or blood sugar levels. And these things are happening to prepare the body to defend itself, again, in a fight or flight response. So either running away from something physically or gearing up to fight something. So this is a very normal process. It might happen in more everyday situations, such as when the fire alarm goes off cooking. Not sure about you guys, but that has certainly happened to me more than once. And although the effects of this can be quite rapid and uncomfortable, your metabolism will return to normal after a short time. So it is normal and it is brief in duration. And that is different from chronic stress. So this is a negative thing in our lives, right? When stress goes unmanaged for a long period of time, that can sometimes result in chronic stress. Unfortunately, it is often ignored. and it is associated with the stresses of daily living. Chronic stress does have a lot of impacts. It has even been shown to impact the structure of the brain, our immune systems, and it can be thought of as even a source of chronic low grade inflammation, which is then associated with other chronic diseases. So, again, it's important to maybe think about your sources of stress and ask yourself if they're acute or chronic. Once you've had a second to do that, we will talk about even more ways to categorize the different types of stress. Okay, so what are the different types of stressors? So, stressors in general are the situations, conditions, people, or things that have the potential to trigger the stress response in us. So, again, stressors are things that stress us, right? I'm sure that's intuitive based on the name, but there's a couple different ways to think about it. So, a brief stressor could be something like slamming on the brakes while driving to avoid something in the road. The example I mentioned earlier, maybe a fire alarm going off when you're cooking. A periodic stressor type is characterized by an example like gearing up for an intermittent deadline for work. And there's even acute stressors, such as being witness to a traumatic event or something that really only happens once. And if you think it's helpful to categorize your types of stress as either brief, periodic, or acute, please feel free to do so now. To build to even more awareness of stress in your life, it can be really helpful to think about the different indicators of stress. And they fall into three different buckets. Some common emotional indicators of stress are things like anxiety, insecurity, irritability, anger, lack of motivation, restlessness, sadness, and even depression can all result from stress. There are also behavioral indicators such as angry outbursts, a change in eating habits, an increase in bad habits, neglecting commitments or responsibilities, and social withdrawal or avoidance. And again, I think the key here is asking yourself whether a change is different from your baseline. Some people, they might always have, for example, a decreased appetite. That might be their default. But if you notice that your appetite is really decreased from your normal, that could be an indicator of stress. So again, it really does look different for everybody. And there are, of course, physical manifestations of stress, things like chronic fatigue, headaches, neck or back pain. Even things like heartburn or upset stomach can be related to stress. And of course, trouble sleeping. All really good indicators of stress. Hopefully, no one is experiencing these symptoms currently, but if that is the case, we'll talk a little more about how to manage these sources of stress. And we'll provide several different resources and activities that you can do to help manage stress. All right. So on this slide, we're going to ask that you sort different types of stress management techniques and ask yourself whether they are ineffective or effective stress management techniques. So, sort of like we did with a previous activity, I will go ahead and read the first option and give you a second to sort it. And so the first one here is drinking alcohol. So, again, if you feel that drinking alcohol is an ineffective strategy, you can put it on the left. Or if you think it's effective, it will go on the right. So, what are your thoughts on that? Yep. So if you guessed ineffective, that would go on the left. And how about the second one here? Learning and applying stress management techniques. So that would go on the right. That is certainly a very effective strategy. Number three, acknowledging stress and committing to reducing it. Similarly, that would be effective. Number four, self medicating or overusing caffeine. If you said ineffective, you would be correct as well. That's an interesting one, not a very common one that I've heard of, but a very helpful thing to know nonetheless. Number five, becoming aware of signs and symptoms of stress. Do we think that's ineffective or effective? That would be effective. How about cigarette smoking? So number six, smoking cigarettes. That would be ineffective. Chances are things listed on the ineffective side would only increase stress in the long run, such as misusing alcohol, smoking, or overusing caffeine. The next one, number seven, is identifying major stressors in your life. We did a little bit of that already, and hopefully you guessed that that is an effective stress management technique. Number eight, lashing out. That would be ineffective, as I'm sure many of you know. And the last two here, number nine, is overeating or undereating as a way to deal with stress. Do we think that's effective or ineffective? That would be ineffective. And then lastly, talking to a professional. Yes, so that would be effective. And again, I'm sure many of you did well on that one. So if this has been helpful and revealing, hopefully you can kind of take stock of some of your choices with regards to how you manage stress, and hopefully that quick activity gave you a couple of ideas to better deal with stress. Next, we're going to talk specifically about job burnout, which, as you can imagine, is very highly associated with stress. So, there's different causes of job burnout. It could be extremes of activity, so maybe kind of highs and lows of how much is put on your plate at work, a lack of resources. Maybe you're asked to do things without enough support and resources to actually complete them effectively. Perhaps a lack of social support at work, a poor job fit. Perhaps your heart really isn't in the mission of the company or the work. Perhaps you have unclear job expectations or expectations at work that are constantly changing, that are difficult to keep up with. And work life imbalance, which is, I'm sure, something we've all thought about before, especially on those instances where we might have had to work late and miss dinner with friends or family. That can be a really big source of stress. And so these are some causes of job burnout. And what do the indicators look like? How do we know when someone is burnt out because of their job? While this is a really difficult experience to go through firsthand, it's really helpful to become aware of the indicators, right? So we can identify it in ourselves and others. And these are quite serious. These would require medical treatment from a professional, of course. So the physical indicators might be things like anorexia, overeating, or poor nutrition, fatigue, hyperactivity, or hypoactivity. Again, especially if it's a really big change from baseline. Insomnia or the inability to sleep, recurrent illness. So those are some of the physical indicators of job burnout. and emotional indicators as well, which, as you'll see, overlap with the physical indicators of stress. But again, these are specific to job burnout, and they include anxiety, critical of oneself and others, forgetfulness, poor concentration, and just preoccupation, an inability to think about other things that are important in one's life. There are more indicators, and these are behavioral indicators. So these include things like diminished initiative, increased tobacco and caffeine use, which, as we discussed earlier, are generally really ineffective strategies at managing stress, as well as increased alcohol and drug use. Other indicators include missing work or showing up late, and again, withdrawal or social isolation. So, hopefully, these indicators give you a better sense of how to identify job burnout in yourself and others as needed. Some other really helpful questions to ask yourself to determine whether you might be experiencing job burnout. Do you drag yourself to work and have trouble getting started once you arrive? Have you become irritable or impatient with coworkers, customers, or even clients? Do you lack the energy to be consistently productive? Have you become cynical or critical at work? Or do you lack satisfaction from your achievements? If you answered yes to any of these, you might be experiencing burnout. Hopefully, that is not the case, but if it is, we do have some resources available that we'd like to share with you. If someone is in need of immediate help, it's a great idea to call the National Suicide Prevention Lifeline, and that number is 988. So, very similar to 911, it is 988. And if someone has warning signs, so it might not be as immediate as maybe a suicide prevention lifeline situation, but if someone needs someone to talk to, there is, of course, many services offered by Geisinger, namely the behavioral health services, and members do have access to personal assistance and a variety of resources for coping with behavioral health issues. The behavioral healthcare team can be reached toll free by calling 888 839 7972. Again, that is 888 839 7972, and they are available 8 a.m. through 5 p.m., Monday through Friday. And if you're just generally interested in behavioral health and stress, it's a really good idea to look at Geisinger's website, community resources, especially things like information on how to initiate care. There are stress self assessments that are really helpful to give you a better idea of what your stress might look like. And of course, there's so many tools and resources out there available on Geisinger's website. And I'd like to introduce a really helpful analogy for thinking about stress. So, if you were to hold a glass of water or a bottle of water, just ask yourself, how heavy is this glass or bottle of water that you're holding? Not very heavy, right? But how heavy will it feel if you were to hold it for a minute or two? So, it might still feel pretty light after a minute or two, but what about after an hour? Yeah, you can probably guess that it might begin to feel really heavy in your arm will very likely begin to start aching after an hour of holding even just a light glass or bottle of water. And what if you hold it for even a day straight? Yeah, your arm will very likely cramp and feel completely numb. It might even feel paralyzed, forcing you to drop the glass to the floor. And so the absolute weight of the glass doesn't really matter. What matters is how long you hold on to it. In each instance, the weight of the glass does not change, but the longer I hold it, the heavier it feels. And so your stress and worries in life are very much like this glass of water. When we think about the things that stress us for only a little bit, nothing really happens, right? We can deal with that. But if we think about them for a few hours, we might begin to feel all the different manifestations of stress, such as physical or mental aching. You might start to have a headache or feel nauseous. Your mood might change, and you'll probably begin to feel down. And if you think about your stress all day, then that's when your stress might begin to completely take over. You might feel paralyzed and numb and just incapable of doing anything else until you drop that stressor. And it might be easier said than done, but it is so important to let go of your stress and worry. And we should remind ourselves that no matter what happens throughout the day, it can be really helpful to put your burdens down so that we don't carry them into the next day. So if you're feeling the weight of yesterday's stress today, just remind yourself to try to put the glass down. So what are some other helpful ways to simplify your life to reduce stress? The good news is that there are so many things we can do. It's always helpful to be realistic. So if you're experiencing stress, just getting realistic about what reducing it might look like, what it might take, how long that might take. It can be really great to break bigger goals into smaller tasks. Getting organized and removing clutter in our physical space can really help our mental well being. At work and in life and with our relationships, learn to delegate and don't overcommit. I think we can all relate to saying yes to things that we might not really be excited about and things that we might not even enjoy at all. I think this is so apparent in our social lives. Perhaps you can think back to a couple weekends where you've been nonstop and you feel, even after doing a lot of quote fun things, you might not even feel recharged and refreshed going into the new work week. And so, kind of examining the things in our lives that fill up our cup and things that drain us can be really helpful when we think about committing. Letting go of the need for perfection can be a very helpful strategy to reduce stress, since that's very unrealistic. And then just planning ahead and prioritizing. So if you are approaching a time of year or perhaps an occasion that you know is going to be stressful, do what you can to plan ahead and prioritize to best take care. Other really helpful strategies include relaxing daily to reduce stress. And it really is about the little things sometimes. So enjoying the company of friends and family, even informally, finding happiness in each day, spending time doing something you love, whether it's a craft, walking your dog, or anything small that you enjoy, spending time to do that can be really helpful. And using humor to unwind is actually a really healthy coping mechanism. Other examples include things like just relaxing with a good book. So these can range from really simple to even more involved options, such as taking a trip, learning a new skill, aromatherapy, or even having a spa day. So, again, just like the different sources of stress look different in everyone, the different stress management techniques will probably look different to everyone. I know journaling is a really good stress reduction tool for a lot of people. That's not something that resonates very well with me. And so rather than beating myself up over that, I've decided to look into different options that work better for me. And no matter what the case is for you, I encourage you to do the same. And just maintaining overall healthy habits like exercising enough, eating well, getting plenty of rest can be super helpful because a healthy body is a happy body. And these are all things that can also reduce stress. We do have a list of some really helpful stress reduction techniques. So these include possibly familiar things like body scan meditations, deep breathing, guided imagery, progressive muscle relaxation, and again, meditation. And since stress is an inevitable part of life and that we can't always prevent, we need to learn different ways to reduce it. Things like meditation are really common, but maybe you can just ask yourself, what is meditation? So take a second to think about that. What do you think is meditation? And we'll share one of the answers in just a minute. So meditation is a mind and body practice used to increase calmness and physical relaxation. It can help us to learn to calm our minds and stay in control in many different kinds of situations. It can be thought of as a muscle. So with practice, we can train our mind to stay calm even when that we are under difficult or stressful circumstances. There are many different types, but they all tend to share some of the same elements: a quiet location with few distractions, a comfortable posture, you're focusing attention on an object, words, or the sensation of the breath. And in general, you have a very open attitude. So you're letting distractions come and go without judgment. Another way this has been described as passive disregard. So you're allowing your thoughts to pass. You acknowledge them, but you eventually don't regard them. So again, passive disregard is a very important part of any stress reduction technique. And something that comes along with stress are physical symptoms such as muscle tension, a pounding heart, increased breathing. And these are all part of the stress response. So, how do we manage those physical symptoms that come along with stress? The opposite of the fight or flight response is the relaxation response. And this was actually developed by a cardiologist at Harvard Medical School. So, there is a lot of research backing this. And there's a lot of different ways to elicit the relaxation response. So, three different ways we can elicit this response are through deep breathing, guided imagery, and progressive muscle relaxation. And so, we will go through each of those now. It's okay if you are not interested in all three. You can skip ahead to the one that you feel most interested in. I will start with deep breathing and I'll just go in order from there to guided imagery, and then we'll end with progressive muscle relaxation. So let's start with deep breathing. So, deep breathing is a very simple yet powerful relaxation technique. It is available anytime, anywhere. It's easy to learn, and it can reduce stress pretty quickly. And it does combine really well with other elements like music and aromatherapy. And again, it's available anytime, anywhere for free. So, let's practice that now. Okay. So, let's start. And just a couple of key points here. Deep breathing through your abdomen helps your lungs take in more oxygen than when you breathe just through the upper chest. And having more oxygen helps you feel less short of breath, less tense, and less anxious. So that is the reasoning behind deep breathing. And to practice deep breathing, you'll first find a comfortable position in your chair. Try to keep your back straight and keep your head, neck, and spine in alignment. And if you're able, put one hand on your chest and the other on your stomach. And to begin, take a long, slow breath in through the nose. As you do that, the hand on your stomach should rise. The hand on your chest should move very little. Slowly exhale through your mouth, pushing out as much air as you can while contracting your abdominal muscles. The hand on your stomach should move in as you exhale, but again, the hand on your chest should move very little. Take another deep breath in through your nose and slowly exhale out through your mouth. Try to inhale enough so that your lower abdomen rises and falls. After you've had a chance to repeat that for a few more cycles, just check in with yourself and ask, how do you feel after doing that exercise? Hopefully, you're feeling a little more relaxed. And so, the next topic, the second technique that we'd like to discuss, is guided imagery. And it's a relaxation technique, that provides a mental escape by helping you to imagine a calm, peaceful image in your mind. It can help create harmony between the mind and body. It can actually stimulate changes in heart rate, blood pressure, and breathing. So it has been shown to make physical changes. And just like deep breathing, it can really be done by anyone and anywhere. So let's practice guided imagery. A few things to remember here are that you can improve with practice. Your mind probably won't go totally blank, and it's okay for thoughts to come and go. The important thing is to acknowledge them and then return your mind to your focus point, whether that's the breath, a sensation, or perhaps in guided imagery, the image that is discussed. So, for this guided imagery technique, it's called Day at the Beach meditation, and we'll begin now. So, similarly to the deep breathing exercise, we ask that you get in a comfortable position with your head, neck, and spine in alignment. So, preferably your back is straight, no matter your position. To start, we'll take a deep, slow breath in through the nose and out through the mouth. As you breathe, focus on how your body feels in this moment. Become aware of any pressure in your body and breathe into that area. Now, imagine yourself on a white sandy beach. The sun is radiating a warmth that comforts you. Sitting in the sand with a crystal clear sky above, you feel the cool blue water washing up gently over your toes as the waves roll in. Again, take a deep breath and let all the tension out. Listen to the waves crashing in the far distance and the seagulls as they fly above you. As the waves drift in and out, you start to feel more and more relaxed. Close your eyes and soak in the sun. Take a deep, slow breath in. Fill your lungs with crisp ocean air and notice the smell and taste of the salt. Relax in the moment, letting everything else drift away, feeling completely content as time passes unmeasured. As you slowly open your eyes, you return from this motionless state and are aware of how calm your body and mind feel right now. So, thank you for your engagement on that guided imagery practice. If you had your eyes closed, you can choose to open them now as we head to our third and final guided technique. This is called progressive muscle relaxation, and it can help relieve muscle tension. Again, it can be practiced anywhere. It does get easier the more you do it. And this works really well if you need help falling asleep. When we feel anxious or stressed, our bodies often respond with muscle tension, and this oftentimes happens without us realizing it. So, when your body is relaxed, chances are you won't feel anxious. And so, again, that mind body connection can manifest itself in that way. So, let's do this exercise here. Some things to remember: breathe in when tensing the muscle group, breathe out when relaxing the muscle group. And this should not feel painful. So the tension should be hard. It should feel difficult, but it should not be painful. And ease up if you ever feel discomfort in any of the muscle groups. Okay. All right. So we'll get started here. So, as always, we're going to just begin with a comfortable, relaxed position. So, you may take a deep breath in through your nose and out through your mouth. And we'll begin. You may close your eyes if you choose to. And when you're ready, shift your attention to your right foot. Just take a moment to notice the way it feels and slowly tense the muscles in your right foot, squeezing as tightly as you can, and hold to that for a count of 10. After the count of 10, relax the foot. Focus on the tension flowing away and how your foot feels as it becomes limp and loose. Stay in this relaxed state for a moment, breathing deeply and slowly. And shift your attention to your left foot, following the same sequence of muscle tension and release. And just take a moment to notice if you feel any different after doing that exercise in your feet. And this can be repeated with other muscle groups. So typically we would work upwards all the way up towards the head and neck. In the interest of time, we're going to skip that part. So you may begin to open your eyes as we wrap up this session today. Our references are shown on the slide now. Some important information here is shown on the slide as well. Thank you so much for joining today's session called Stress Less. We hope you found it helpful. And please take a moment to reference all of the member resources on this final slide. If you are able to implement any of these strategies today or have another success story to share with us, please do so at the QR code shown on the bottom right of the screen or go.geisinger.org/share your story. Thank you so much again for joining our presentation.